Hello, and welcome to our Ask Anything call, Holistic Nutrition webinar series on detox supports fertility and PCOS. I'm Elizabeth Naylor with Ebenezer Wellness. I work in the field of holistic nutrition, and I'm here to talk about the issue of PCOS and how it impacts our health and what, from a nutritional standpoint, we can do to correct that. So let's start with what polycystic ovary syndrome is. It's typically defined as high levels of male hormones, specifically testosterone in women, and a chronic lack of ovulation. So this lack of ovulation, what we're saying is that the eggs don't complete and ovulate, and that's what gives the lumpy, bumpy appearance to your ovaries that can often be seen when you do an ultrasound. And this results in a variety of symptoms. Okay, so one of the biggest issues with PCOS is that it's very difficult to diagnose. It has a wide range of symptoms. Many of them can be viewed as common in today's society because we're all eating diets that maybe aren't supporting our hormonal balance the way that we would like. And so the fact that young women have irregular or absent menstrual cycles or acne or weight gain and obesity, that could be caused by many things, right? And it could be, you could have that in a large percentage of your population, and yet only a small percentage is actually going to have the high levels of testosterone and this chronic lack of ovulation that you often don't know about really until you want to get pregnant, and so then it becomes a fertility issue. Hirsutism is male pattern hair growth that's typically on the face, and so that's a common side effect of this because you do have high testosterone and a higher risk of certain diseases, and we're not going to really talk about that today, but basically they're the same diseases that go along with weight gain and obesity. So the prevalence of this today is 5 to 10% of reproductive aged women, so 12 to 45 years old, in the United States are estimated to have PCOS, and this is approximately 7 to 10 million women. It has a huge impact on the individual. It has a psychological impact due to the fear of infertility, due to the embarrassment of the symptoms, which involve acne and hirsutism or the hair growth. It can also involve alopecia, which is hair loss, so male pattern baldness. So you can actually lose a lot of your hair, and then weight gain. So symptoms and self-image issues due to weight gain and obesity. These are all part of the PCOS syndrome. And your quality of life can often be impacted due to obesity, the risk for diabetes, the risk for metabolic syndrome, and cardiovascular disease. And it's estimated that the impact on society is exceeding $4 billion. So key factors in what causes the development of PCOS. The first factor is genetic. There is definitely a genetic component. One or both parents carry the gene for PCOS. It seems that there's actually a 50% risk factor of developing PCOS if you carry the gene for it. The males tend to have fewer symptoms, but females tend to have more of an impact. But secondly, there is an epigenetic component. Epigenetic simply means above the genes. It means something other than the genes. I tend to view that as the environmental influences. So there are environmental factors above and outside the genes. And there's this two-hit hypothesis. The two-hit is that either you have hyperandrogenism, which is just high testosterone, is developed through several possible mechanisms pre-puberty, and so then that pre-existing high testosterone disturbs the normal balance during puberty, and it locks that into place. Now, those several mechanisms really have to do with diet. a large part with diet and this idea of insulin resistance and having a diet that increases your chance for sugar handling problems because it's high in carbs and high in sugar. So the primary goals when we're talking about PCOS, the primary goals are to reduce the insulin resistance. Okay, so to reduce your body's ability to handle carbs and sugar is really limited when you have insulin resistance. And insulin resistance is really what we think holds PCOS in place. So it's one of the things that drives the PCOS symptoms. And so if we can reduce insulin resistance, and we can also reduce the free or active testosterone, then we actually reduce the increasing symptoms. So symptoms of hair loss, of hair facial hair growth, of acne, those things are all symptoms of higher testosterone, and we can reduce those when we change our diet. And so this is what happens. Improvements in all of these areas will happen when we're able to get our diet in a better place so that we reduce insulin resistance and our ability to reduce free testosterone. And so I like to talk about, does what you eat matter? This is the standard American diet. Okay, and this is a really pretty version. And so I like to start with the pretty version because, it's beautiful, right? You've got the beautiful blueberry muffin, you've got the latte, it's lovely. For breakfast, for lunch, you have a panini or a lovely sandwich on French bread. It looks great, a baguette. Dinner, you have fabulous pasta. Maybe there's a few pieces of chicken thrown in there, some red wine. This is the standard American diet. But the one thing that you notice about this diet, it doesn't matter if it's pretty or if it's casseroles and fast food. The standard American diet does not support healthy blood sugar balance. And that's the one thing you need to know. It does not support healthy blood sugar balance. And so when we talk about detox supporting PCOS and detox supporting fertility, what we're talking about is when you do an anti-inflammatory / Mediterranean / detox diet, because they're very similar. And that's a whole other conversation, but they're very similar to each other. When you encounter doing those diets, what you end up doing is reducing your body's insulin resistance. You're putting yourself in a place to better manage blood sugar. So this particular study is on a low-carb ketogenic diet, which, let me be clear, that's definitely not necessarily a Mediterranean diet or an anti-inflammatory diet, and it's not even necessarily most detox diets, although it is the way that I do it. This particular report is on the fact that diet can impact your health. Diet can certainly impact your insulin resistance and some other symptoms. And I put this in here because I think that this is very reflective of how using a detox diet that's also ketogenic can support you, because the dietary plan that has had the most research for support in PCOS is the low carb ketogenic diet or a similar low carb diet. Okay, what I think is helpful about the purification program as part of this is because your liver and your gallbladder particularly have to process any excess hormones to get them out of your body. And so since a key component of PCOS is high testosterone, it's very important to be able to get your liver and your gallbladder tuned up to do that effectively. And so I think doing a detox diet as a ketogenic diet can be a really helpful place to start. Okay, so this study was conducted at Duke Medical Center in Durham, North Carolina, and it was a pilot study. There were 11 women for 24 weeks, so it's about 6 months, and they were on less than 20 grams of carbs per day. That is a very low-carb diet. I'm just going to point that out. Very low-carb diet. But what they saw from that is significant reductions in all of these areas. Okay, and I particularly am impressed with the testosterone reduction, because that's a key, again, that's a key component of problems with the symptoms that go along with PCOS, and the ratio of LH to FSH, which is your pituitary hormones that determine your progesterone and estrogen. The ratios there were the ratio was much improved, and most importantly, I think for the long term here, is that fasting insulin was much improved. Okay, your insulin levels really are very important in the management of PCOS, because you get high insulin, hyperinsulinemia, and that is one of the things that holds that PCOS in place. So as you see, this number is reducing, you're going to have a good chance of improving diet. And then there were not significant decreases in these other areas, and in this process, 2 women became pregnant despite previous infertility. What we find is that when people change their diet and eat a cleaner, healthier diet across the board, and lower carb for sure is part of that, that a lot of their hormonal imbalances come back into play. Okay, so I'm going to stop here because I have tons of information about this subject, and we have a very short call. And so I just wanted to give you this introduction to how diet, particularly a detox diet that's done with a bit of a ketogenic twist, can really support fertility and PCOS. And so I'm going to stop for a minute and look and see if I have any questions. Okay, so one of the questions is about low carb diets. Is that really something that you can do for the long term? And is there really a difference in the quality of the carbs? I will answer that here. I think that yes, there's definitely a difference in the quality of the carbs. I think that some people can successfully do a very low carb diet for the long term. It's something that I believe if you're going to do that for the long term, you're going to want medical supervision, because you're going to want blood work done, and you're going to want to see what's happening, particularly with your cholesterol levels. I'm not a big believer in thinking cholesterol's got to be in this really low, tight band, but you do want to know if your change in diet has dramatically increased your cholesterol. And then there's some other things that you can look at, like if it's actually caused, if the higher fat, higher protein, because some people eat a low carb diet and that simply means eating meat and fat, and they don't eat vegetables, right? And you could eat a lot of green leafy vegetables and still be on a ketogenic diet, which is the healthy way to do it. It's more of the detox diet in the way that I do it. And so I don't think that everyone who eats a low-carb ketogenic diet does that in the healthiest manner. And so I think if you're going to do that for the long term, you're going to want to check that out. But yes, carbohydrate quality definitely matters. There was a study at the Harvard School of Public Health back in 2009, and it showed that, and it was on over 18,000 premenopausal women who were followed for 8 years as they attempted to become pregnant or not pregnant, and they kept track in terms of what they ate, what they didn't eat, and what they were really looking for was to investigate the role of diet, particularly their carbs, on fertility. And so they started at the beginning, they talked to them again in 4 years, and then they talked to them again at 8 years. And overall, what they found was that there was a positive association with total carb intake, where it was increased at the expense of naturally occurring fats. So, in other words, if you are eating a lot of carbs, you're not eating good fat, that's not good. They also found that overall high glycemic foods like cold breakfast cereals, white rice, potatoes, those kinds of foods, those kinds of carbs, increase the risk of fertility problems. They were looking at ovulatory infertility, which is basically PCOS. So cold breakfast cereals, white rice, potatoes increase the risk of this type of infertility, while low glycemic foods, lower glycemic carbs, such as brown rice pasta, dark breads, were associated with a reduced risk of infertility. And so yes, the carb quality really does matter. And so when someone says to me, well, I can't eat a low carb diet forever, I'm like, well, okay, just let's eat let's eat good carbs, right? Let's eat, first of all, root vegetables are all higher in carbs. So sweet potatoes, butternut squash, um, those types of things. But also you've got brown rice, you've got quinoa, you've got whole grains, whole wheat grains from breads such as Ezekiel bread, those type of breads. If you want to add wheat, a lot of people have a problem with wheat, so that's also a question to consider. Okay, so let's see if we have any additional questions. Okay, there was a question about are there other lifestyle habits like exercise that can help? And yes, absolutely. Exercise helps with PCOS mainly because it helps with insulin resistance. And so they have done studies that show that moderate intensity exercise really supports lower testosterone, the reduced hair growth, reduced waist circumference, and reduced fasting insulin. So, yes, absolutely. Moderate intensity exercise done regularly. I like to say 5 to 6 days a week, meaning 30 minutes, 5 to 6 days a week, really support reversing insulin resistance, and that itself is going to support fertility issues and PCOS. Thank you so much for being here today. We're going to end the call now, and I love to hear from you, and I love to get your questions. So please stay tuned for our next call. Next week, we're going to be talking about how detox supports allergies, and I'd love to have you on here with your questions. Thank you. See you soon.